I decided to come to Schneck Integrative Medicine to see Sherry Arbuckle, the nurse practitioner, because I had been fighting with PMS symptoms for probably 5 or 6 years, honestly. And the treatment, I'd done a lot of research, and the treatment plans were antidepressants and birth control pills. And so I'm not depressed, and I didn't feel like that was the route I wanted to go. So I chose birth control pills, and I was on those for about 5 or 6 years, and I gained about 50 pounds while I was on those, and I still didn't feel great. It still didn't really take care of anything. So I thought, I'm fed up, I've had enough. I'm gonna go see Sherry, because I knew she was doing a lot of treatments with hormonal therapy and checking hormones, and that was just something that I was really passionate about. I wanted to know what was causing my symptoms. I didn't want to just throw something at it. I wanted to know what the problem was. And my family was very supportive, because I was a moody, grumpy nightmare. And so they were like, yes, go see Sherry. So I came in and I spoke with Sherry, had my consult, and she basically said everything that I was experiencing before I could even tell her. Like, when I said, I just feel so angry and agitated, she said, yes, like you have a ball of rage. And I was like, yes, the ball of rage.
I listen to their history, and then we talk, and then a lot of times it's with their symptoms, it's usually pinpoints a hormone imbalance. There's something, most of the time the woman knows something is going on within her body. That I listen and, have they had labs done? Have they had other testing completed? And then, a lot of times it does point, well, let's just go ahead and check your hormones.
And I just felt like vindicated that she understood what I was talking about. So we did the hormone testing, and when my results came back, they were terrible. They were absolutely horrible. And I still maintain that I told her she needed to have some sort of like chart. If I have the lowest progesterone level out of all of her patients, I deserve a prize, I feel like, because from what she explained to me and where I was in the testing, they wanted an optimal level for my progesterone to be 200, 300, and I was at 37. So that was fantastic for me, because I just felt like, yes, I knew something wasn't right with my body. I knew something was going on that was making me have all of these irregular periods and fatigue and hunger and anger, agitation, stress, like all of these things that I just felt like were being band-aid, or bandaged. It wasn't like it was being addressed. And so she started me on a new treatment plan. I've been on that for about a month now. I feel fantastic. I have 0 sugar cravings, which is a huge thing when you're a 40-year-old woman, not to have sugar cravings. And I actually get out of bed in the morning, and I don't wake up tired. I have energy to go and exercise, to participate with my family. My family doesn't want to put me in a shed in the backyard because I'm moody and hideous to be around. So it's great. I just feel like I can't sing her praises enough. She just really helped me out a lot. I'm just so thankful. Years, I've been fighting this for 6 years, and people were just like, do you want some Zoloft? Do you want some Prozac? I'm like, I'm not depressed. 3 days out of the month, I'm hideous. That's it, 3 days. I'm a horrible person to be around. I don't even want to be around myself. And that was it. And I just kept going, well, here, take this, or here, take that. And nobody ever looked. And I just feel like a whole new I feel like myself. Run, do not walk, pick up your phone. You have it in your hand already because you're on TikTok or Facebook or whatever. Get your phone, call Integrative Medicine, make an appointment with Sherry. You don't need a referral. You can get a new patient appointment with her immediately. She'll work with your PCP. She'll look at your hormones. She will do the tests that you need to do to figure out what is going on. And sometimes that's just the biggest relief, is even if you don't follow through with the treatment, even if you don't, at least then you know. And sometimes that's all you really need, is just to know what's going on. And she can absolutely help, find that answer.
So when a patient comes in, I like to meet with them and hear their whole story. I want to know what is going on with them so I can work with them on an individualized plan.
I mean, if you can figure out what is going on with your body, individualize it, an individualized plan, I don't see why you wouldn't want to do that. I mean, we have one life, and we need to do everything we can to make sure that we are at our optimal level, and that we are doing everything we can to take care of ourselves, that we're putting the right things in our body, and that we're exercising, and that we are taking care of ourselves. Because if we don't take care of ourselves, we can't take care of all those people that we, as women, have decided that we are responsible for. So, I mean, if this is the one thing that you do for yourself, do it. Do it now.